awesome epidemiologist right here. This is Ken?
Komatsu, yes.
Komatsu. Very cool last name. But so we're here at the Department of Health Services, and we're here to interview him on his awesome job and any sort of experience that you've had with like background and whatnot. So first starting off, can you tell us about how you came about your education and your experience before actually getting this job?
Sure. My undergraduate degree is in microbiology from the University of Arizona. And I think that's what kind of piqued my interest in this field.
Mm-hmm.
And then I went into food microbiology for a little while. I worked at Armour-Dial.
Mm-hmm.
And at that particular job, we would often investigate complaints of foodborne illness associated with their food products. And so I was in the laboratory, and we would run through a number of tests whenever someone complained of a food poisoning.
Mm-hmm.
And so that's very much like what we do here at the health department. And so that's when I got the interest in epidemiology.
There's a lot of lab work then? You actually take the food and sort of
Well, at that point I was doing laboratory work.
Right.
Now I don't do laboratory work anymore, but we use the laboratory for a lot of our evidence gathering.
Very cool, very cool. Did you have to do any sort of furthering your education to specialize in epidemiology?
Yes, so then I went from that job to UCLA,
Mm-hmm.
to their School of Public Health with a degree in epidemiology. And within epidemiology, you can specialize in many different areas, and one is infectious diseases. There's also nutrition, there's population health, there's environmental health, behavioral health, substance abuse,
Mm-hmm.
many different areas.
Nice.
Cancer, of course, chronic diseases.
Right. What is your
My specialty is
Yeah.
in infectious diseases.
Okay. Very cool.
Because of my background in microbiology, I think, went along with that.
Definitely. Next question is, I can read from here. Prior experience. Is there any sort of experience that you needed to, I know at least for, say, for nursing, to go into any sort of graduate school for, to become a CRNA, you need some sort of experience working to, further getting to the graduate program. Is there anything like that for the epidemiology at UCLA, or was it just straight into school?
Actually, it's a master's program,
Mm-hmm.
so they do take individuals and students from many different areas, like anthropology, biology. It could be almost any area that could go into public health.
Okay.
And public health is a very broad field. It's really trying to study the population as a whole
Mm-hmm.
and their health status. So it's really we're here responsible for all of Arizona and the health status of Arizonans. As opposed to a physician who's looking at a single patient at
Right.
a time. We're trying to look at the whole population at a time.
Are there any sort of personal skills that you need for the job? Anything, interpersonal skills that
Well, let me tell you first what an epidemiologist is and what they do. Epidemiology is really the study of the distribution of diseases and health events in a population.
Mm-hmm.
So we look at the incidence of, say, H1N1 influenza in Arizona, things like that. It could be also diabetes or different kinds of cancers or obesity or arthritis, something like that. Injuries, obviously, would be something we would want to track. So
Definitely.
in order to ascertain what is that distribution, we do a lot of surveillance.
Mm-hmm.
And that's one of our key principles of epidemiology, is to monitor whatever health event that you're looking at in the population. So how do you gather that information or some proxy of that information? So obviously we track all births and deaths in the state, so that's one good source of information. And other things like infectious diseases, we have administrative code that requires a physician to report it to us, physicians in hospitals and healthcare facilities.
Mm-hmm.
So we get those reports, they come in, some are electronic now and some are on paper still. And then we have to compile them into a database, and then that's what we run our reports on, and we can see what the trends are going on.
What do you feel like, at least, for something off from these questions, like in Arizona, like what is the most prevalent, disease or issues that we have here?
There are a lot of disease issues here. But let me continue a little bit about epidemiology.
Okay.
So I think a lot of people think of epidemiologists as disease detectives. I don't know if you've heard that. It's kind of like the game of Clue. You're trying to put in the right person, place, and time.
Right.
And so, especially with investigating outbreaks of infectious diseases, we're always trying to find out, who got ill and who was at risk. So where it's just a small, group of people went to a restaurant that got sick, it was everyone who went to that restaurant who were at risk. And then what foods did they eat? What time did they go there? How long did it take them to get sick? What was the nature of their illness? Do we have a diagnosis for that disease so we can figure out what we're looking for? Then is there food left over that we could test for that particular disease? And how did that food become contaminated? Was it something that grows normally on that food, or was it somehow contaminated from an outside source? And where was that source?
Mm-hmm.
So you're always trying to find out kind of who, what, where, and why.
Right.
And to be able to stop and identify that source and eliminate its impact on public health. So again, it's kind of that detective work that we're trying to do
Okay.
at the same time.
So do some epidemiologists work in like hospitals?
Yes.
Okay.
Hospitals, they also use them for pharmaceutical companies when they do a clinical trial and they compare a placebo versus another drug, and they do those double-blind trials. They use epidemiologists there. Certainly health departments use them, hospitals, nursing homes. Actually, industry is starting to use them as well. Lawyers use them occasionally because when there's a foodborne outbreak or recall of foods, some people want to sue
Right.
for damages, and so they use an epidemiologist to help them gather that evidence to make their case.
Interesting.
I believe a tire company had asked the Centers for Disease Control to come in and look at how they could detect defects in their products earlier.
Mm-hmm.
So just like we would try and detect outbreak as soon as possible, they are trying to do the same thing with their products.
Cool.
So the tools can be used in many different situations.
Do you feel like, at least, I personally haven't, wasn't familiar with epidemiologists before actually researching it for a project. Is it a competitive field? Like, is it limited, space of the profession? Is it growing? Do you know anything
Well,
about
I think it's growing because obviously there are many new diseases always coming up,
Right.
and we have things like pandemics going on, so you
Right.
need a lot of epidemiologists to handle that. With bioterrorism and 9/11,
Right.
there was a big push for public health preparedness activities to prepare for a bioterrorism event or a disaster. And so there was a lot of jobs opening at that point for epidemiology.